Thank you, everybody. It's such a pleasure to be here today. And I'll be presenting with, my name is Oluwasoga, and I'll be presenting with Genevieve Oni, my partner in life and in business.
Okay.
It's always usually...
okay, we're going to stand here.
Okay. Yeah, so at Mdaas, the company we started, we build and operate modern tech-enabled diagnostic centers in clinically underserved communities, starting with Nigeria. And before we start, I just wanted to acknowledge the rest of my team who are not here today. We have Joe, who runs our supply chain, and we have Opeyemi, who is currently in Nigeria running the business while I'm here right now. Actually,
There we go.
yeah. So this is where it started, or where I met her. This is where we went for our first date and had amazing, interesting conversation. And during our second date, I took her to, the order of this is wrong. I took her to my class, a class I had at the time called Development Ventures. That was the second date, just to impress her. And in that class, though, one of the challenge for that class was that we have to create an innovation that will touch 1 billion lives. And I was presenting that day the very first version of Mdaas. And the people I spoke to while I was in that class was my dad and his friend. These are their two clinics. And the problems they had with equipment. So they had this huge problem with medical equipment, accessing it for to use for their patients, and they didn't know how to either buy it in a way that is cheap or even service and maintain it. And since starting, we also see some really broad trends within the healthcare sector, that there's a massive shift right now that is going on between infectious diseases like malaria, which gets a lot of mentions, and lifestyle diseases like heart disease and cancer and the rest. And at the same time, we see that there's a growing population and a growing middle class who are willing to pay for better care. But unfortunately, what we see is that the existing healthcare infrastructure just can't keep up with the pace of the demand. And as part of that class that I had at MIT, we started Mdaas to source, equip these low-income and middle-income hospitals, and also provide, very importantly, service support for them. But that's Mdaas 1.0. But what we quickly realized at Mdaas 1.0 was that the problem actually goes really, really deeper than that. And that for these doctors that serve these low-income populations, their patients can't even pay them enough money to justify that medical device purchase. Particularly when you look at lifestyle diseases, because to diagnose malaria today is just a strip that costs about like 30 cents. But if you wanted to diagnose cancer, you need either an ultrasound or a mammogram. And that costs a lot of money to get. And so, given that the patients are poor, they can't justify the purchase of that equipment. And so quickly we realized that some of the people that were our patients, our customers, were actually the big hospitals who were looking to save money instead of buying new equipment from GE and the rest. So this is a picture of one of the warehouses for our suppliers. So most of our equipment at the time came from suppliers like this in the US. So we're able to take this surplus in the US from the secondary market, refurbish it, and provide it to those doctors. And this is me doing one of our installations, and this is a model, not an actual patient. What we see was that overall, that the patients that need these equipments the most still were not able to get access to it just because they were not in city centers where there's a lot more money there. So that thinking drove us to do Mdaas 2.0, which I will let Genevieve talk about.
Thank you. So as Shoga mentioned, we had been working on our sales and equipment sales and services model and realizing that we weren't able to actually reach the patients in low and middle income communities because hospitals just don't have the economies of scale they need to be able to purchase and maintain a lot of this equipment, even at lower price points. So with Mdaas 2.0, we set up and run our own diagnostic centers. We provide imaging, cardiac, and lab services, so a wide range of diagnostics available to patients. And we act like a centralized diagnostic department for the surrounding hospitals and clinics. So we currently partner with over 60 different hospitals, clinics, and labs who all refer patients to us. So we see patients through walk-ins, through partnerships with labs, through employers and health insurance organizations, and by aggregating demand from all of these different sources, we're able to keep our utilization rates high and price points really low for patients. So this is our very first diagnostic center in Ibadan, Nigeria, that we launched in November 2017. And to date, we've served almost 10,000 patients at this center. We broke even on our operations in just 5 months, showing that there really is demand for these services and that we're able to make the unit economics work. We have 15 staff members who work here, so providing jobs and fulfilling careers in the healthcare space and helping to give doctors career paths so that they don't have less incentive to leave the country. And as I mentioned, we provide a wide range of services here, so it's similar, kind of a one-stop shop for all of your different diagnostic needs. And in order to do this, we have 3 main competitive advantages. The first one we've talked about a little bit, which is our vertically integrated supply chain. So because of our history as a medical equipment supply and service company, we already have this expertise in sourcing, shipping, installing, and maintaining medical equipment. And so we're able to use that to dramatically reduce our setup costs. We're about 60% cheaper to set up than a lot of our competition, which means we can target low-income patients. The second is our focus on service. So we really focus on what the experience is like for patients coming into the center. It can often be pretty scary coming in and getting a diagnostic test done. So we train our staff on how best to interact with patients, answer their questions, and then follow up with both the patient and their referring doctor afterwards to make sure that they know what their next steps are for care. And then finally, all of our medical equipment is digital, so we have an electronic medical record system and a tech component of our business, which enables us to streamline patient operations and take advantage of things like telemedicine and e-consultations. So we don't need specialists on site at every single center. We can easily connect them online to the people that they need to see. So that's our very first center. Shoga's going to talk a little bit about our vision going forward to round us out.
Yeah, one of the things that we realized when we started this new Mdaas 2.0 was that anybody can start a clinic in Africa. People do it routinely if you're wealthy enough. But what is special about what we do is that we're building for scale from the ground up. So everything we do, we make sure that we're scaling. And doing that makes it easier for us to attract outside capital to be able to actually spread our work everywhere. So right now, we only have 1 center, but we just raised some money, and now we are going to be building 4 more within the next 12 months. We're really, really excited about this. And these centers take usually roughly, like Genevieve said, right now we see about average of 30 a day, but each of our centers will be like 9K to set up, 90, and we would be doing around 180K within 1 year. So that margin is the gross margin at the center level. But each of these centers is actually quite profitable by themselves. So at scale, we would have hundreds of centers across Nigeria, and then we'll look to West Africa and also East Africa. We see that even right now we've gotten some requests to set up in other countries, but right now we're still refining our model in Nigeria. And this is not just about diagnostics. We hope to, or we're going to be moving to other verticals of care. So primary care is one thing that is really important. Dialysis is another thing that if you need dialysis in Nigeria right now, it's almost like a death sentence. And so that's something we're excited to get into, endoscopy, chronic care management disease. In short, we are a platform that once we set up within a community, you could leverage us to get other things into that community. So another part of healthcare that is really, really difficult is distribution. And so, but we are pretty much the perfect distribution channel because we're locating in communities that need this services the most. And so at scale, we'll be the biggest, the most trusted provider of primary care and diagnostics. And this is the vision that really drives us. This is us. We talked about us before, so I won't repeat it. And our biggest supporters, MIT Legatum has been amazing for us. I can't stress the support we got from them enough. Thank you so much, Georgina. And other people that have supported us over the years, and this is us. So you can follow us. Thank you so much for having us here. We really appreciate it.